name is Megan. I'm going to be performing a physical assessment on you today. If you could tell the camera that it's okay to do the assessment and video you.
It's okay to video me for the assessment.
Okay. First, we're going to start off with the cranial nerves. Cranial nerve number 1 is olfactory. I'm going to wash my hands. Olfactory is the sense of smell. So if you could cover one of your nostrils for me and tell me what you smell.
Vanilla.
Okay. Do the other side.
Cinnamon.
Okay. Cranial nerve number 2 is optic. And we have already performed his Snell and eye exam, and he had a vision of 20/20 bilaterally. Cranial nerves number 3, 4, and 6 check for the cardinal field of gaze, and those are oculomotor, trochlear, and abducens. So I'm going to get you to follow my pen light and follow only with your eyes. Do not move your head. Okay. Cranial nerves number 3, 4, and 6 are intact. Cranial nerve number 5 is trigeminal, and that is the sensation of the face and chewing. So if you could chew. Good. Now close your eyes and say yes when you feel this.
Yes. 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 Yes.
Okay. Cranial nerve number 5, trigeminal, is intact. Cranial nerve number 7 is facial. If you could close your eyes, open, smile, frown. Okay. Cranial nerve number 7 is intact, and it also checks for the adequacy of saliva. If you could open your mouth. Okay. Saliva is adequate. Cranial nerve number 8 is auditory or vestibulocochlear. If you could close your mouth and cover one ear and repeat these numbers.
1, 2, 3.
Other side.
4, 5, 6.
Okay. Cranial nerve number 8 is intact. Cranial nerve number 9 is glossopharyngeal, and that checks for the obstruction of the parotid glands and for swallowing. And cranial nerve number 10, vagus, also checks for swallowing. So could you swallow? Okay. That is intact. So cranial nerve number 10 is intact. Check the parotid ducts. There is no obstruction. So cranial nerve number 9 is intact, and 10 is also intact. Cranial nerve number 11 is spinal accessory. You can shrug your shoulders. Good. That checks for the movement of the trapezius, and that is intact. Cranial nerve number 12 is hypoglossal. You can stick out your tongue and in. Okay. Cranial nerve number 12 is intact. Upon entering the room, I noticed the patient's gait was steady and even. He had no abnormal or involuntary movements. It was even. The patient is alert and oriented ×4. He is answering questions appropriately. We have already checked his vital signs and his height and weight. He is dressed appropriately for the situation. His hygiene appears to be neat and clean. He is, his posture is slouched. His hands are crossed across his lap. He is smiling. And his mood and affect are appropriate. And now we're going to start, and we're going to go from your head to your toes. And if any time you feel uncomfortable or if anything is tender, let me know. I'm going to wash my hands again. Okay. And looking at the scalp, I noticed that his hair is evenly distributed. There is no abnormalities of the hair. There's no balding, no excess drying to the scalp due to this tender.
No.
Okay, there's no tenderness. I do not palpate any lumps, masses, nodules, or thickening. I do not see any nits or lice to the base of the neck or behind the ears. You you could lift your head up. Let me know if this is tender. The frontal sinus.
No.
Maxillary.
No.
Okay, good. There's no tenderness to the frontal or maxillary sinuses. So we are going to take a look at your mouth. And looking at the outside of his mouth, his lips are pink. They are dry. They are not cracked. There's no lesions or inflammation. Okay, I'm going to shine my light in there if you open your mouth. And looking at his gums, there's no, they are pink and moist. There's no inflammation, no redness, no lesions. The buccal mucosas are pink and moist. The hard and soft palates are intact. Say ah. The uvula rises to the midline. It is pink and moist. The tonsils are present, and I would grade them A+1. The pharynx is pink and moist. I do not see any dental caries or malocclusions. I do see some malocclusion to the lower row of teeth. They do overlap slightly. You can stick out your tongue. I do not palpate any lumps or masses to the tongue. I do not visualize any lesions on or below the tongue. It is pink and moist. Now we're going to move on to your nose. And looking at the nose, I do not notice any septum deviation. There is no exudate or drainage to the external nose. His face is symmetrical and proportionate. Now, we already know his nares are patent because he did pass his olfactory test. So now I want to look up inside your nose. There's no redness or swelling or drainage or exudate. There's no lesions. I can visualize the middle and inferior terminates. Okay? Now we're going to take a look at your eyes. And looking at his eyes, the eyelids, close your eyes. There is no masses or lumps to the eyelids. There's no discoloration. The eyelashes are evenly distributed. Is there tender?
No.
There's no tenderness or swelling or drainage to the lacrimal ducts. There's no excess tearing. Can you open your eyes? His conjunctiva are pink and moist. His scleras are white. His irises are green bilaterally. And there is no inflammation to either of that. You can look right at my nose. His pupils are equal and round. They are a size 4 millimeters bilaterally. Look at me. His eyes, the pupils do constrict to size 3 bilaterally, and they are equal, round, and reactive to the light accommodation, and the accommodation is direct and consensual. Now I'm going to get my ophthalmoscope, and we're going to dim the lights and set this to 0 odometers and come in at a 15-degree angle. Good. And check his red reflex. Good. His red reflex is intact bilaterally. Now I'm going to take a look at your ears. And looking at his ears, they are aligned and proportionate and symmetrical to the other facial features. I'm looking at the external ear. There is no masses or redness. I do not palpate any lumps or masses or nodules. Is that tender? No. The external ear canal has no drainage or exudate that I can visualize. When you're looking inside the ear, you want to make sure that you choose the right size cover and looking inside their ears. Okay. I'm looking inside the ear. I can visualize the tympanic membrane. It is pearly gray. The cone of light is at 5 o'clock. I do visualize the umbo, manubrium, and short process. Okay. And looking at this ear, it is symmetrical and positioned aligned with the other facial features. I do not visualize any external ear canal drainage or exudate. I do not palpate any lumps, masses, or nodules to the auricle or tragus. I did not palpate the lumps, masses, or nodules on the other ear to the tragus or the auricle. And looking at this ear, like I said, I do not see any external ear canal drainage. So now I'm going to look inside his ear. I do visualize the tympanic membrane, and it is pearly gray. The cone of light is at 6 o'clock. I do visualize the umbo, manubrium, and the short process. Okay. Now, going to palpate around on your neck and different lymph nodes, and you let me know if it's tender. The pre-auricle, post-auricle, the occipital, posterior cervical, the tonsillar, submandibular, submental, superficial cervical, the deep cervical chain, and then the supraclavicular. No tenderness? Okay. Any other tenderness around on your neck? Okay. There's no tenderness to the neck. I do notice that his neck muscles are symmetrical and proportionate to his body. If you could do what my head does. Chin down, up, back, side, side, and all around. Range of motion is intact to the neck. I'm going to palpate for the carotid arteries. Good. Now I'm going to listen to them with the bell of my stethoscope for bruits. No bruits are heard. You could lean a little bit forward and to the right. I do not palpate the thyroid gland. Now, we're going to be taking a look at your chest. You could go ahead and lay down for me. I mean, not lay down, but take your shirt off. Kind of turn your back towards the camera for me. Okay, and looking at the posterior chest, there is no skin abnormalities. There is some freckling. Chest expansion seems to be even and unlabored. I'll go ahead and get you to take a deep breath. Okay. Lung expansion is even and symmetrical. Now I'm going to percuss. There is some dullness heard over these spiny prominences. There is some resonance heard throughout. Now I want you to tell me if this is tender. Tender?
No.
CVA tenderness is negative. Now I'm going to get you to repeat the words 99. There you go. Say the words 99 when I touch you.
99, 99, 99, 99.
Okay. Good vibrations are felt throughout. Now I'm going to auscultate. vesicular sounds are heard throughout. If you could turn towards me. There we go. And looking at the anterior chest, there is no skin abnormalities. There's some freckling and some hair. Chest expansion seems to be even and unlabored. Take a deep breath. Okay. Lung expansion is symmetrical. Now I'm going to percuss. Okay. There's some dullness heard over these bony prominences. Now I want you to say the words 99 when I touch you.
99, 99, 99, 99.
Okay, and that checks for tactile firmitus, and there is some good vibrations felt throughout, as there was on the back. Now I'm going to auscultate. There's some bronchiovascular sounds heard up top, and the rest sounds are vesicular. Now we're going to move on to your heart. In visualizing the chest, I don't see any chest heaves. I am going to listen to 5 different points of the heart. We have the aortic at the second right intercostal space. The pulmonic at the left second intercostal space. The Erb's point at the third left intercostal space. The tricuspid at the fifth intercostal space on the left side. And then the mitral, or point of maximum impulse, is at the fifth intercostal space. I'm going to palpate for that. And we're going to compare to the radius, because the point of maximum impulse is the apical pulse. Now we're going to compare to the radial. Okay. Those are equal and strong, and he had a heart rate of 75. Now, when you're listening to the heart sounds, you kind of want to do it when they're leaning forward, and we're going to do it when he's lying down also. If I can get you to put your head right there. Okay. The aortic, second intercostal right space. Pulmonic at the left second intercostal space. The Erb's point at the third left intercostal space. The tricuspid at the fifth intercostal space on the left side. And then the mitral, or point of maximum impulse, on the fifth intercostal space. Okay. Now we're going to move on to your abdomen. And looking at the abdomen, I do not see any pulsations or bulging. I do notice that the contour is flat. There is no skin discolorations. There is no striae or stretch marks. There is one scar to the right lower quadrant, and it measured 3 inches from a appendectomy. There is some hair. Now we're going to auscultate your vowel sounds. Okay. Vowel sounds are normal active in all 4 quadrants. Now we're going to listen to some arteries for bruits. The aortic, it's not really heard lying down. The renal, the iliac, the femoral, okay, and no bruits are heard throughout. Now, since I have him lying down, I'm going to check his femoral pulse. Okay. I would grade those a 2+ bilaterally. Now I'm going to percuss your abdomen. Okay, there's some tympany heard throughout. Now we're going to do some light palpation. And do not palpate any lumps or masses with light palpation. Now I'm going to do a little bit deeper. Take a deep breath in. I do palpate the liver, kidney, I'm unable to palpate the spleen. I do not feel any lumps or masses with deep palpation. Any tenderness? No tenderness. Okay. Now, while you're lying down, I'm going to have you do some range of motion to your lower extremities and your hips. And looking at the lower extremities, there is no signs of muscle wasting. Now, we're going to do this with one leg, but you would do this bilaterally. So I'm going to lift your leg up and down. Knee up, over, and down. There is some crepitus palpated to the patellar joint. Swing your leg out and over. Okay, knees up, push against. Okay, legs down. Push against me. Good. His legs are equal and strong. Now, I'm going to get you to sit up, and I'm going to let you put your shirt on. Let me get this out of your way. Now we're going to do some upper extremity strength. I am going to get you to stand. I'll let you face the camera and you just do what I say. And you would do this range of motion bilaterally also. Yeah, do it with that other arm. Stick your arm out, down, forward, down, back, down, up, and down. Stick your arms out. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Okay, good. No palmar drift is noted. If I could get you to stick your arms back out, do your elbows like this, in, out. Now do your wrist, up, down, all around. Fingers out, in, thumbs out. Flap your hands, all around. Okay. Range of motion is intact to the shoulder, elbow, and wrist, and also the fingers. If I could get you to walk that way, come back, scoot back just a little bit. Heel to toe, go. Okay, good. Now come back. If I can get you to face me, put your hands down, come closer. We're going to do what's called the Romberg test. I'm going to get you to close your eyes. There is no swaying. Okay, good. I could get you to turn sideways. We're going to do some coordination. If you could touch your nose, bring your finger out. Touch your nose. Do it with the other hand. Okay. Now if you could turn towards me and touch your nose and touch my finger. Okay, good. Now I want you to grip my hands. Squeeze. Okay, his grips are equal and strong. Push against my hands. Okay, now pull against my hands. Okay, grips are equal and strong. I am going to get you to sit back down. Whoop, got my stethoscope. Now we're going to do some pulses. I'm going to check your brachial pulse. We're going to do these bilaterally. Okay, I've graded those a 2+. Radial pulse. 3+ bilaterally. Ulnar. 1+ bilaterally. Patellar. Popliteal, 2+. 2+ bilaterally. And dorsalis pedis. 2+ bilaterally. And the posterior tibial. Is 2+ bilaterally. Okay. Now I want to do some reflexes. I want to do your biceps first. I say 1. 1. Now your triceps. 2. 1. Now we're going to do your brachioradialis. Okay. 2. 2. Now we're going to do your patellar. Sorry. I've graded that a 3. And that other one a 3. Now we're going to do your Achilles. It's a 2 bilaterally. And if I could kind of get you to lay back and lift your foot up for me, we're going to check the plantar reflex in an upside down J manner. Okay, good. The toes should not curl down, so that is good. Now I'm going to do some what's called a 2-point discrimination, and you let me know when you feel 2 points, okay?
Yes.
2 points?
Yes.
Okay. I'd say his 2-point discrimination is about 1.5 inches apart.
Yes.
Okay, and then about 1.5 inches apart on the left side. Now I need you to tell me when you feel sharp. This is sharp. This is dull. Okay? Close your eyes.
Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp.
Okay? Patient is able to differentiate between sharp and dull pain. Now, we have done your reflexes and your pulses. Now I'm going to verbalize the breast assessment. He's opted to not let me assess his breast. In the breast assessment for the male and the female, I would look at the external breasts for any dimpling, indurations, discolorations. I would also palpate in a consistent circular manner around the areola, looking and palpating with the tips of my fingers for lumps, masses, or nodules. I would also squeeze the nipple with my forefinger and thumb for any drainage or discharge. I would also look at the axillary and epitrochlear lymph nodes. For the genitalia, the male genitalia, I would assess the distribution and if there is any discoloration of the pubic hair for any nits and lice. I would also look at the inguinal opening, going and palpating down through the inguinal opening for any hernias or lumps or masses. I would look at the penis and palpate for any lumps, masses, or nodules. I'll look at the urethral meatus for any drainage, swelling, or tenderness. I would also look at the scrotum and assess that it is symmetrical to the body. I would also palpate for any lumps, masses, or nodules. I would look at the external rectum and look for hemorrhoids. And then I would do a digital rectal exam. And I would hope to find a heart-shaped firm gland, which is the prostate gland. For the female genitalia, I would assess for discoloration of the pubic hair, for the distribution of the pubic hair, if there is any presence of nits or lice. I would look at the labia majora and minora for any discolorations or redness, tenderness. I would also palpate for any lumps or masses. I would look at the urethral and vulvar openings for any redness, swelling, or tenderness. I would look at the female rectum for any external hemorrhoids. And I believe that is it. I did forget one thing, but I remembered it. Can you tell me if you feel any tenderness?
No.
Okay. That is palpating the mastoid process. He feels no tenderness, and I do not visualize any swelling.